good to go whenever you're ready.
When the world faces a massive pandemic where every day thousands of lives were at risk or affected, the way to solve this most effectively and most quickly wasn't by waiting for years and years for a vaccine to be developed or sticking up barcodes on shop windows. It was placing massive pressure on businesses and people to get vaccinated because that's what got you herd immunity. That's what kept most people safe. Because the difference between like a 90% or a 97% efficacy rate for a vaccine threatened too many lives for a marginal social benefit, a slightly better sounding statistic. What's our stance in today's debate? We think it's really important to set a few definitions in order to set the scope of the debate. When we're looking at early, we think this looks like between a few months to about a year and a half. We think that's a realistic time to develop a vaccine that has been planned and thought out. When we're looking at promising vaccines, we think that looks as like no serious side effects emerging in human testing and lab testing. If a few people are getting a fever, we think that counts as promising rather than really legitimate harms, such as respiration or blood levels being at a really high level. Early stages are going to go through the same similar multi-level stage of testing. This is going to be heavily compacted and shortened. This looks now like at first going through standardized lab testing at the beginning. If effective, then proceeding to human trials, which are going to then be monitored whether they're effective or not on the regulations we just gave you. Then we're getting regulatory groups to assess its efficacy. We think if it's approved at around a 90% mark, that's largely proved as being effective. We're just noting that things like animal trials and things like that have been included, which is largely going to be discredited due to like the overwhelming evidence that most of these actually in the long run are beneficial to vaccines and massively reduce the time. So if any of these fail within the time span, we're just going to follow the status quo and not advise people to take them until successful, which may be a few years. Medical treatment that we're including under our side of the house looks like COVID vaccines. It looks like things like the flu and measles. We think that moderate to severe health risks largely fall under our category. We're going to win this debate if we're going to prove to you we get better health responses with minimal health risks. With that in mind, we have 3 substantive points in our debate today. Firstly, how we improve health outcomes. Secondly, the enhanced efficiency in the healthcare system. And then the split bridge that second on how we incentivize science and innovation. So let's look at my first substantive point on how we improve healthcare systems. Because note that we're telling companies that if they have to accept medical treatment at an early stage, that tells us that it's really, really important that people are willing to risk slightly less efficient vaccines because it's worth the trade-off of getting seriously ill by a virus and possibly even dying in the 10 years that it would take you on side neck to get the vaccines. Here's why I improve health outcomes for 2 major reasons. Firstly, we just tell you that the likelihood of vaccines being so dangerously harmful and detrimental to people's health are really low on our side of the house. Firstly, why is this? We tell you that medical treatment is so demanded that it demands to go to early stages of testing. It's a massive onus for companies to be really secure and methodic for vaccines to be given to millions of people because the company doesn't want its reputation to be tarnished by resulting in severe health outcomes. We tell you yes, companies are largely incentivized by profit. They also rely on consumers telling other people that it's a really reliant brand. That's what gets you a profit. We tell you that scientists with lives on the line actually do care about the goodwill of society because that's where they win. If it's so severe, we tell you that these companies are largely going to be happy to take the risk. It's the reason we have numerous vaccine organizations not willing to take the risk in countries to have it as a national vaccine because the stakes were so severe. Secondly, we just tell you what's going to be far more effective for health outcomes as a quick response. Because most of the years in developing a virus goes from developing it from 90% to 97%, from 95% to 97%. We tell you it doesn't actually take years and years to establish a really good base level of vaccine. What it does take is years to just enhance very nuanced cases of vaccine strains. That's where the bulk of the time happens. We tell you we're probably going to get similar results, but even if one gives you a slightly worse side effect, e.g. you maybe have a fever or a slightly sore arm, 1 or 2% more people contracting an illness than the 50 to 60% of people who are going to get it in the 5 to 10 years it took you to get a marginally better illness was just a gain we were not willing to take. Because when you're in a state of such urgency, you simply cannot afford to wait. That's something really unique on our side of the house, where we made the trade-off of a few % of people at risk versus the millions of people. Because Because when you have the lack of agency and benefit on the other side of the house, that's when you get poor health outcares. So what are the impacts of this? Two things we want to make here. Firstly, get more of the population vaccinated quicker. This looks like the net majority getting the better outcomes such as herd immunity faster. It's really important to get all these things running, like the economy back on track, when people can actually go out and engage in society. We've had a massive issue within the COVID realms and New Zealand's economy, that being really, really dangerous, and basically both parties agreeing that that had to be instituted quickly and efficiently. That's what happens when we get the bulk of society vaccinated quicker on our side of the house. But secondly, we just tell you, we minimise the death and illnesses on our side of the house because we don't have to wait for years and years to get the marginally clear gains that we told you about in our point. That's the most important side of the debate because we don't think it's a trade-off that we're willing to make just for a few people to get maybe a few, 5 to 10% better risk of the illness versus the thousands and millions of people who are going to have to wait for a vaccine that was really, really dangerous. So that's my second sustainable point, how we can enhance efficiency in healthcare. Because note that we've already established that at the point where we have to go to early medical treatment, there's a massive pressure to get the vaccines. We see this things like COVID, we see this things like Ebola and swine flu. These are very rapid health responses that didn't take decades and decades to produce because people realized how pressing it was and it literally threatened people's lives. We tell you if they want to bring up dangerous side effects, this is just endemic to any virus. We tell you that things like AstraZeneca largely sort of been accepted, like blood clotting issues, etc. We tell you these things, very minute cases, take decades and decades to produce. Even with largely approved vaccines, we still have this on both sides of the house. So how do we actually get better effectiveness? Two reasons. Firstly, we just tell you scientists now have a very rapid, efficient response because now there's a bigger pressure and a more collaborative response. This is what happened with COVID vaccine rollout so quickly because we had a united response. That was so important. If they want to bring up competition, we tell you if competition gives us better vaccines in a shorter time frame, we're really happy to stand for that. And secondly, on government involvement, we think it's far more likely for these governments to put in greater funding to install and employ greater scientists with more qualifications to get the success because it's really important for them to be seen as targeting health responses efficiently and effectively, basically being the stages of vaccines and health illnesses that have been really harmful to their society and their population. So on the impacts of this, we just think at worst, we're getting marginally worse vaccine treatments, and at best, we're getting massively condensed strains health responses and scientists working on these on the multi-level stage treatment we tell you. We're far more likely to get effort and directed attention that you simply just don't get with the complacency of scientists who don't have the agency acting on them when you tell them it's okay to wait 10 to 12 years for a vaccine. I think it's far more likely that we remove the stagnancy and bloating that you simply cannot afford when the health system is literally crying out for people who are being effective. I think it's really important today that we don't waste years of development that be achieved quickly on our side of the house to a very, very similar scale. Proud to propose.
Wonderful. I thank the speaker for her speech and I invite the first negating speaker to begin her team's case.
Thorough testing and approval processes save lives, putting people at risk by permitting them to access unfinished medications with known implications is both unethical and dangerous, and is not something we stand for in this debate. Today, we're going to bring you 3 major reasons why we do not support the idea of releasing these medical treatments very early to the public without having the final approval process going through. One, this harms vulnerable people, specifically people in poorer countries. Secondly, this requiring final approval process means better medical treatment. And thirdly, our second speaker will tell you that this increases research, that by having this policy, you increase research and development costs. What we tend to do today is prove to you that we get lower quality vaccines and harm and disadvantage vulnerable people under their side of the house. So before my rebuttal, I'm going to give some context to this debate. We support a world where we do not allow people to access medical treatments until they have been thoroughly tested and proven safe, which requires longitudinal studies, something I'll elaborate on soon. We can support medical trials as a part of the research and development of medical treatments, but we would not advertise these treatments widely to the public or allow the general population to begin using it as a treatment very widespread until it has been proven safe by an extended longitudinal study, something we know we need in our society. So now I'll go into some rebuttal. So the affirmative team case has relied very heavily on COVID-19, and well, I'll explain why COVID-19 is a special case unlike other medical treatments. So there's many points to this. Firstly, we've actually seen unsuccessful COVID vaccines, like the Johnson & Johnson one being involved and actually damaging a lot of people's livelihoods. We've seen very horrific harm to this. Even if this were true, we still have more layers to this rebuttal. Because firstly, COVID-19 has huge global impacts to the everyday citizen. So as a result, too, they had massive resourcing and funding so they could get through the approval process easier, unlike other medical treatments. Thirdly, most COVID vaccine developers were government-run, and there were more ethical testing practices, unlike private corporations who risk poor communities, something I will come back to in my substantive later. To enter this, we see that most medical treatments had adverse harms, including COVID-19. But even if you didn't believe this, this is where the majority of the debate lies, is we're talking about medical treatments in general, and we've still even rebutted the ones about COVID. This is different because of the funding and the nature of this vaccine. And even then, we don't have a longitudinal study on this, and also there's many points to go into which you'll see brought up in our substantive. So firstly, this harms vulnerable people. Low socioeconomic population have a high need of medical treatment. There's also a lot of mistrust in healthcare systems, and there's an example of a drug trial with the infection of black people in the USA with the STDs. We've seen this as being something historically recognized. That you also will have mistrust for the healthcare boards and institutions not willing to do drug trials. Many people desperate for hope and will do anything. This works on 5 levels. Firstly, vulnerable groups that may choose between the drug or not took it because they have less access to medical care and will often actually have worse medical outcome because they do not get the real benefits that they want to claim under their side of the house. Many people take risks because they are desperate. They want to prevent death or harm, and they are given a false hope. Only privileged people feel they have access to actually better outcomes because not everything is government funded. Yes, COVID was, but a lot of medical treatments are actually very expensive, and it's only access for white, rich people. And the ones that are really poorly done are actually rolled out to poorer communities and countries because they are underdeveloped and they just don't care. And we don't actually hear about this on the news, but we've seen this happen historically now, which I will again address later. Fourthly, this can be inaccessibly expensive because as you're doing the trials, it takes a lot of money. So I think people go into more. It takes a lot of money. Each time you realise, like the Johnson & Johnson, that, oh my gosh, this has not been really good. We've caused a lot of harm to this. We have to do more research. So you just see this influx of having to add all these costs rather than having something more stable and having an end product which is not only more successful but also costs you a lot less in the process. Furthermore, fifth, we've seen historically and currently big private corporations go into poorer communities in countries like Kenya with the early forms of birth control, where women were trialed and it passed all the necessary protocol of approval for use, but as it did not meet the final stage of approval, the women had severe health effects that led them down the line to heart. Now, because these are specifically poorer countries, you don't hear about this. You didn't hear about all these horrific women struggling. You can watch documentary online, these women struggling in Kenya because of the effects of the early trials of birth control. They even said that they weren't properly warned of the possible side effects. They said, oh, do you want to try this new birth control? Because they obviously desperately needed birth control, but because it was such early testing, They did not know about the side effects. This was not warned to them, and we didn't have the longitudinal study of how bad it would be. These are private companies. A lot of medical treatments are run by private companies, and they're rolling out these terrible medical treatments that just have really bad adverse effects in the long term and the short term. Secondly, in our substantive, we get better medical treatments. Medical treatments go through extensive testing for a reason. This is to eliminate or heavily reduce harmful side effects of health harms, which come out in longitudinal study, which you can't predict right at the start of your research. When treatments are made publicly available, often only in the early stages of testing, people risk severe high side effects or even death. An example of this, as we said, is the Johnson & Johnson vaccine, which has been approved after only preliminary testing and ended up causing blood clots and health problems, which in some cases has led to death. More times than not, we see this happening in the world. There is a smaller death cost, and we can keep the ones we love safer. So, what this debate comes down to is a trade-off of benefits and harms for who delivers the best healthcare. In a nutshell, it's speed versus quality. So at best, on that point, they are able to quickly roll out successful medical treatments with minimal side effects and societal harms. We see this as a good thing. However, and this is key, at their worst, which is a lot of the time, as we've explained before, it is run by these big private corporations and damaging foreign nations. They risk people's lives. They create distrust around medical care because they've seen it fail, so why would there be an incentive to trust healthcare? And they also get worse results and adverse effects, especially for poor nations that don't have these stories spoken out to. In comparison, at our worst, we have to wait longer for these medical treatments to be quickly accessible. Means a slower process to gain health benefits of successful treatments. Now this, of course, isn't great, but these harms are much less than affirmative. And further, at our best, we get safe, stable health benefits with more medical backing, more trust in healthcare, less money spent on it, and achieve this outcome, and better medical treatment. Something we've proven to you in this debate. We get the best benefits at our best, and we get the least detrimental harms at our worst. Therefore, we win this debate, as that being a contingent part of the case, we are proud to oppose.
Wonderful. I thank the speaker for her speech, and I invite the second affirmative speaker to continue her team's case. Hold on, just before you begin, the judges are just sorting something out. Cool. Good to go. Yeah.
I just kind of wanted to come out and just fact check what came from the first week on the negating side. So under the Johnson & Johnson, right, where they talk about it makes blood clots, it's actually been proven that these blood clots are less prevalent in people who get the Johnson & Johnson vaccine than those who get COVID, right? This is just a fact. And so I'll just be moving on to my kind of introduction now. So when we tell scientists that their work will take 12 years to complete with no promise of an outcome, we completely deter the reason they would do this trial in the first place. So I will further develop this in my split, but first I'll rebut with kind of two areas of class. So we see the first is what is the effect on people and what are people's opinions to this new medication. So first, they kind of came out and said that COVID is just not a good example because it's government run. This is just not true. You use the example of Johnson & Johnson. This is not a government run thing. Same with Pfizer, same with these other ones. They're just not government run. That's just not a factually true thing. And they talked about they were government subsidised. Yes, this is true because the government saw the necessity in having these vaccines produced at a faster rate. That is why they were subsidised. They weren't subsidised for some random reason because the government chose to. We came out in First Speaker and told you this is why it was necessary, and the government even supported that by subsidising it. They also talked about this, and this kind of goes on people's opinions, the mistrust in the government. They talked about that being under their side of the house, that being a harm on our side of the house. But we actually see this as a harm on theirs, because when we don't look at the fact of people who need this medication, right? They talked about low-income households, but when we don't create this vaccine, these are the people that need to go to work, for example. If we we just see this as like, oh, we don't trust the government because they're not trying to protect us, right? They're looking at, we want this like medication now. We don't care if like in 10 years we can go to work. They need to go to work now and get their income. And so they talked about like the long-term effects in terms of health. So like while we can see like these effects happening, which you gave that example, we just see 12 years is not enough to actually being a long enough time to see these long-term effects. And we've seen this like discussion in terms of like laser eye surgery, right? No one is actually old enough to see the long-term effects of laser eye surgery. If you got like, no one is like at that age where they're seeing the long-term effects, because the long-term effects are actually dependent on like when people's immunity is shut down. So when you're older, obviously your immunity is going to be lowered, and that's when you're going to see the effects of this medication on your body. So we just see this as like being a sunk harm on both sides of the house. Like obviously we're not going to be able to combat these long-term effects, but neither are you, because neither are they, because 12 years is just not enough time to be able to see the long-term effects. And so just like we've proven that like when we have governments backing this, like backing the COVID vaccines, backing this other medication, we see like this greater actual trust, kind of linking in that other point they said, we see this greater trust in the government because people realise, okay, maybe they do want to support my life. It's actually not just pushing towards having like these wealthy people that they wanted to characterise with the vaccine first. When governments subsidise it, they're subsidising it so that more vaccines or more medication can be produced, so they can be more widely distributed to these people who need it, right? Like it's not just this thing, and especially in New Zealand, where like getting the vaccine doesn't cost anything, right? We want to see the people, like people have the opportunity, the people who need it are going to go get it because they are the ones that need to go to work. They don't have time to sit and wait for 12 years. I will move on to my point now. So when we push to see the benefits of like...
Point of information.
Yes.
Do you have any mechanisms for private corporation medical treatments, which is actually a lot of medical treatments in the world today? We see this with taking attention on.
Yeah, well, like we've just proven that governments, when they see a good when they see a good like company producing stuff like Pfizer, like Johnson & Johnson, which I just fact check basically, like they will like subsidise this, and so we just see like this is not actually contingent. Like companies aren't suddenly less trustworthy, like then the negating team is characterising them out to be. So we just see this as like not actually that prevalent in the debate. Like governments will subsidise where they see necessary and they won't where they won't. Like it's just going to happen. And so when we talk about like health-related breakthroughs, where the affirmative team is far more likely to scientists and companies to develop medication through the greater incentives, right? So we see two reasons as to why this is true. We see first being cost versus outcome, second being current crisis insensitive. So onto my first reason as to why this is true, the cost versus outcome. So not all proposed medications obviously will not get passed by the time these trials are finished. And this is just common on both sides of the house, right? Like if Pfizer in its first stages, like it wasn't guaranteed to get through. This is just like something we see, just in context. But when you look at like the cost of funding a 12-year trial, it will ultimately be more due to the resources and use of service. And then in terms of subsidising, like when the government sees necessary, they will subsidise things. So that ultimately makes these shorter trials cheaper. So kind of looking at this from a scientist/company kind of view, what we see to weigh up whether they believe that they will actually, one, have enough money to fund this, two, absolute confidence that this will pass, and three, is it going to be necessary in 12 years. So ultimately, a scientist who may have an amazing idea, right, but doesn't believe that all these things could be true, will lose an opportunity for a possibly effective medication. So while a scientist should be confident enough, we agree this, there is no way that they can guarantee their success. And like what will happen is companies will be less willing to look into niche areas of medication, but rather more common and already like developed and are likely to pass, so that they can get this like this incentive to do this and this outcome of like benefits in terms of money. So like under our side of the house, scientists are more likely to go through with this like lesser trial, but like still with enough confidence, because like obviously it still costs to go through with this trial. It's not something that they can just like throw their things into and just do. Like it's still going to cost money, but like at worst, we still see an incentive to create medication, but with enough effectiveness to ensure the safety. So moving on to my second reason as to why my split is true. This is, we also see the current crisis incentive of scientists like larger companies being affected by this move. So at the point where we would still be researching the Ebola vaccine, if it had not been approved, to have a short time trial is just such a clear example of why we don't need these long trials in the time of crisis. Scientists, right, if they don't have incentives to, scientists don't have incentives to trial things from multiple years ago because of two reasons. So first, they see a clear crisis now pushing them to conduct better science, and they've got an actual reason to do this. Second, there is no point where by the time it's completed, the harms are just too extensive. So at our worst, we see scientists creating marginally less effective vaccines, but as our first speaker stated, the importance of herd immunity and the importance of just getting this out there just proves we will have better outcomes as this outweighs the cost of having just slightly less great vaccines. So the negating team has to stand for longer infection rates, therefore a way higher chance of pandemics and deaths.
Awesome. I thank the speaker for his speech, and I invite the second speaker of the negating team to continue his team's case. Also, just before we clap, would you please be able to press the quick start button for the light switches? Thank you. Just so they don't turn off mid-speech. Yeah. Awesome. Hold on, we'll clap for you now. It's fine. They'll just die soon.
In this debate, we have seen from the affirmative side a case that focuses on what has happened in the past and with extenuated and limited circumstances. They have claimed all of their benefits from the quick approval of coronavirus vaccines. We're telling you this is actually not useful in the scope of this debate for three key reasons. First of all, COVID-19 is a once-in-a-100-year situation, which is actually not relevant to the fact that there are people with diseases who need medications that work effectively. Secondly, we tell you that the extenuating circumstances of coronavirus, being that vaccine companies got extended funding from the government, like Pfizer and Johnson & Johnson, to rush through the trials early. They have failed to realise that the vaccines have actually gone through all 4 stages of a medical trial before being approved. Let me go into a little bit more depth than that after I introduce my speech. Look, in my speech, first of all, I'm going to respond to the content they've provided, and then continue the substantive material of my case, and then finally deliver a split win, which is how this increases R&D costs and decentivises companies from research and development. Look, the medical trials come in 4 stages, 1, 2, 3, 4, and they guide through the different parts of the process where they have different groups of people trying. This moot and the info slides specifically say that this process is 12 years, and sometimes people get access early. This moot specifically says before the completion of the finalisation, which we say is stage 4 trials, people have access. This is not true in COVID-19, which went through all 4 stages. However, we say that the harms we have seen in the COVID vaccine can still be seen under our side, under their side of the house, and they're actually made worse. Right, first of all, let's respond to the content they have said. They have basically said to us that we need to save the world in these kinds of situations, that COVID-19 and the early vaccine approval has changed everything for the better. We have told you, and this is why their case completely falls over, has already happened. We do not believe that realistically another COVID-19 situation will happen, and if it did, extenuating circumstances would change this. The scope of this debate in reality is about drugs for severe diseases like cystic fibrosis that harm people's lives, that need treatment but cannot be done urgently. Look, we tell you that by changing the MOOC, we're not going to change the fact that COVID vaccines have reached approval, which is something that this MOOC does not allow for. This MOOC specifically says that before they have reached approval, they are adopted. So, what have they said against our case? They have said that they get better health outcomes and they get better efficiency in the healthcare system. In terms of health outcomes, yes, while they concede, yes, we concede that the COVID-19 vaccine has been approved quickly and has had some definite and tangible benefits. We have said that the small harms, which has come after a rushed but very thorough trial process, have still been there. and they have gone completely under the radar. We tell you that if drug trials are only the first or second stage, these medical conditions, these medical problems that were picked up in the COVID vaccine stages and fixed would not have been fixed, and they would have been more widely spread in the community. So therefore we tell you that you get worse health outcomes. Even if we're to believe them at their best and say that you do get better health outcomes, it does not change the systemic issues that we face. My first speaker, Arcadia, touched on this, and I'll get into a little bit later. Now, they've also said this improves the efficiency and research and development and makes things better. We tell you this actually provides a disincentive because companies become more liable for the effects of their medicines if they are promoted and marketed as a final product even when they are not. And so that's why they've completely mischaracterised this debate and they've failed to focus on the real actors who need it. Vulnerable people with niche medical diseases who need urgent treatment and a new hope of life, but cannot face the difficulties and deaths that untreated vaccines will cause. So let's continue the substantive material of our case. Look, in countries across the world, there are significant years.
So we 95% of animal trials that pass, and then they fail in humans. How is this a necessary step in trials?
Well, animal trials show basic physiological effects. Humans are actually quite different from animals, and you need to be as thorough as possible with these samples. Now, basically, we have large groups of people in New Zealand here and overseas who do not trust the medical system, do not trust capitalism, and have had genuine experiences happen against them. We use the example of black people in the United States who were inoculated with a drug that the US government said would help them, but in reality was infecting with STDs for a trial. This was really well known, and this really spread amongst the community. This has created a significant hesitancy not only against untested and unwidespread medicines, but the medical companies and their claims. This also happens in New Zealand, where we have distrust amongst authorities by some groups, including Māori and Pacifica, due to historical acts against them. We tell you that this will harm their outcomes for the following reasons. First of all, they will not believe the claims that these wonderful drugs, even in extenuating circumstances like COVID-19, if they're to be believed, and this is believed to be relevant, they will not necessarily take them up. We tell you that these people in the poor socioeconomic conditions already have more access to healthcare and already have the most severe medical conditions. Because they don't believe it, they don't actually reap the benefits. And the only people reaping the benefits are the privileged people who trust the government and generally have less severe medical conditions. We also tell you that this doesn't work because the changing disparity in the system, where you would have privileged people with good medical treatment, supposedly from the early approved medicines, and people disadvantaged getting it, we would actually make this worse because we would see a system where those people believe that the system is geared against them and that they are always let down and will never get good treatment. We tell you that this will harm their outcomes. Now, the split point for my case. This actually increases research and development costs and harms the production of new medicines. So, I want you to imagine a graph. If this is a y-axis and this is costs, and this is the x-axis and this is time. As medicine is first developed, you have extremely high research and development costs because you've got to do the initial discovery. As the trials go on throughout the years, the cost goes down because you're actually perfecting the medicines, carrying out the trials, and making minor adjustments. We tell you that if we improve vaccines early, when the costs are up here, if mistakes are made, companies will generally not feel incentivized to continue and perfect it but start again. We tell you this for the following reasons. First of all, if you have a widespread early drug that has a big failure, this creates huge run-on consequences in society. You will receive negative publicity, and companies do not want to continue this drug because no one will buy it, and their costs will not be worth it. They will not get the money back. We also tell you that companies will be more liable with lawsuits because of this, and therefore they will see more pressure to do the right thing. So companies will choose not to invest that high cost if they believe that through access to trials, they will keep losing it. That costs them too much money, and they will never get it back because they end up throwing away their time and resources. We also tell you that because of this, companies may choose either to do the full trial without allowing people and therefore completely invalidating their benefits, or might choose to stop focusing on those medicines that could really help people who need it, like those cystic fibrosis sufferers, but instead continue focusing on the medicines that are already available and are already helping people. Look, at the end of these points, we tell you that, first of all, vulnerable communities who have poor health outcomes will only get worse health outcomes and will continue to distrust the system more. We also tell you that companies who invest in research and development will be disincentivised from doing it, and we will, in the long run, actually get less medicines and worse health outcomes. We may see tangible benefits now, assuming that interpretation of the case is correct with COVID, but in the long run, we see disparity, we see distrust, and that is why we're winning this case, and we've really failed to engage.
Wonderful. I thank the speaker for his speech, and I invite the third affirmative speaker to conclude the substantive portion of their team's case.
Inside proposition tried to tell us that the exclusive harms of having people in Kenya, having women in Kenya take really, really harmful medicines from big private companies who are going to exploit them with their way of winning this debate, they ultimately failed their own case. This harm is completely non-exclusive. We tell you it doesn't really matter whether you have lots of vaccines and lots of really, really developed vaccines for people research or non-developed vaccines. That's a relatively symmetrical thing on both sides of the house. I bring two clashes to the house today. Firstly, who benefits healthcare outcomes the most overall, and then secondly, who uplifts those from developing nations and those socioeconomic classes. So firstly, onto this clash about who benefits healthcare outcomes the most. Note that we think this is really, really important material in this debate. We think it's feasible debate-winning material because we can prove that we adequately benefit healthcare outcomes within this debate. Healthcare is really, really important because it can kill people. There's really, really significant impacts. What did we tell you? We gave you so much material about how we do this. We told you we improve healthcare systems. We have vaccines that are able to develop health responses quickly. We have quick responses, and it's going to aid people's quality of life. We told you we have enhanced efficiency, and the scientists have an incentive to produce quality vaccines that are going to save lives. They had two key claims of response. Firstly, they told us that we couldn't use the example of COVID-19 because it's an exception, because it's just a once-in-a-lifetime disease. Quite frankly, this just completely didn't engage with all the measures, it did all the material I just told you. But secondly, it's just not true. Under their case, all the people in every country would be dying due to COVID because they don't have, it would take 12 years for a vaccine to be developed. We tell you there's things like SARS disease, there's things like Ebola, there's things like a swine flu, which was literally 10 years ago, that had really, really rapid vaccine responses, which wouldn't have had the sufficient extensive longitudinal testing that they talked about. That's really critical, because at that point you still get the health benefits. We think that's really, really important. Secondly, they told us that it's going to be research and development and extensive longitudinal training, and that private corporations are just going to exploit people and not put the correct things in the medicines and just put shady stuff in there. Three responses to this. Firstly, 12 years actually isn't long enough to see a long-term response. I think Bridget covered this really, really well, but at the end of the day, the difference between 1.5 years and 12 years to an immune system is not that great. Secondly, let's look at the incentives acting on companies and scientists, because they try to tell you that companies are just going to compromise everything in their vaccines to just get the most money. Okay, companies are inherently incentivized by profit, but we tell you the scientists in those companies have an incentive to produce vaccines and medicines to output science that's actually going to benefit and save people's lives. Scientists aren't going, it's within a scientist's job, they're not going to put really, really shady stuff, no matter how much they try to be coerced by the CEOs in the companies. At the end of the day, the science is actually enhanced on outside of the house because we have more research, we have more development due to the high demand, because people are going to be really, really negatively impacted. But thirdly, even if we take them at their best and accept there will be shady stuff in these medications, we think even at the point you have a few people having a sore throat and having a few negative side effects, I think that's so much, We don't think that's okay. We think that's so much more preferable than people dying or going through years of suffering from not having medicine, from not having vaccines rolled out in their thing. Yeah.
I actually believe that people dying of blood clots is more important than sore throats and vaccine side effects.
Okay, we accept that there will be some side effects. I think Mia clearly outlined in our model that if there are serious side effects prevalent in the promising testing, we won't be outputting the vaccines. But even at the point that the minimal vaccines that do get through the system, we still think that's a trade-off we're willing to make if we can actively benefit so many people as we've proved. Secondly, who uplifts those from developing nations? They tried to tell us that people from low socioeconomic places are going to be so detrimented by our case. They told us that we fill them with we exploit people because we gave you the example of Kenya. As I flagged in my introduction, we don't think it's okay that women in Kenya are taking harmful things, but we think it's relatively symmetrical. The fact that private corporations are going to be ripping people off is not and exploiting people is relatively symmetrical. Not really sure what they're going up here. But secondly, they gave us a far more compelling line of analysis about how it's going to be more expensive for these people. I have three responses. Firstly, we tell you low socioeconomic people have a direct incentive to actually consume the vaccine, consume the medicine. Why is this? Because if you can, if you have $10 and you have the vaccine costs $10, where you can get $10 from going to work, which you literally can't because you're sick, you're obviously going to invest your money into buying the vaccine rather than working to support your family, even at the expense of putting food, of providing for your family. I think that's a trade-off that people will be willing to make so we do get better health outcomes there. Secondly, we think that they're never going to be able to have access to niche healthcare and niche diseases, niche cancers on their side of the house so much more. Because at the end of the day, when you don't enable the vaccines to be outputted under this move, they're never going to be able to access the niche healthcare. We think that's really, really critical because we think niche diseases are probably more prevalent in people from low socioeconomic areas. But thirdly, we think it's so much more harmful for people to have to die instead of paying a bit of money. We think people are going to be so much more susceptible to the harms of their health impacts if they're from low socioeconomic areas and they're from low developing nations. Therefore, we should do everything we can to uplift them and have vaccines that are outputted. I'll take a POI there as well.
So you claim that companies have good incentives when they talk to their partners, but where does the incentive lie when there's no accountability because we don't hear about the stories because they are poor nations and underrepresented in the Western media?
Okay, I accept that companies, we never really heard why the scientists within the companies are going to compromise their science in order to exploit people and get a bit of money. We heard from the negating team that they're really, really bad and we don't hear about them. Well, what we didn't hear is the reasons that I just outlined why scientists are going to compromise their science, the career they pursue. The reason that they pursue science is not to compromise people and kill people. It's to actively uplift people. It's to create vaccines that are going to benefit people's lives, that are going to benefit their quality of life, and they're going to help people to have a more sustainable future with a higher life expectancy. At the end of this debate, we benefit healthcare outcomes the most. We uplift those from developing nations. We don't kill people. I'm so proud to propose.
Cool. I thank the speaker for his speech, and I invite the third negating speaker to conclude the substantive portion of today's debate.
immense mischaracterization from the affirming side today when they told us that on their side, at worst, people only receive slightly average healthcare treatment. Realistically, on our side, we tell you that at their worst, we see people losing trust in the healthcare system, we see underprivileged people being far worse off, and most importantly, we see people die. This is simply not good enough as a contingent, and is a reason why AF ultimately loses the debate today. 2 points of clash in this debate. Firstly, how treatment and medical trials work outside of the COVID world, and secondly, how people trust and access the healthcare system, particularly if you're an underprivileged minority. Firstly, let's look into how this works outside of the COVID world, because what AF has tried to focus on today really can only work in the sphere of COVID, right? They chose to pretty much entirely ignore all of our arguments that were not contingent on COVID-19 existing. This is where they ultimately lost the debate. I'm going to tell you how. So what they told us today is that because the COVID recovery and production of vaccine was really speedy, it means that everything else now, because of that, can be really speedy. Secondly, and I quote from their first speaker, it doesn't take long to get it good enough. We think on our side of the house, good enough is actually really not good enough, particularly when people's lives are at stake. Firstly on that, we tell you, at Travis, we said COVID is actually a really exceptional case. People have been able to carry out this funding of research really quickly because you have hundreds of different governments throwing funding at this problem. So they were able to carry out the 4 full stages of testing in a short amount of time. This is a very exceptional case, right? It's contingent on there being funding. In the real world, outside of COVID, when we just for everyday other medical treatments like cystic fibrosis, where you don't have hundreds of governments throwing money at the problem, you don't get the same support. You don't have the ability to run through all 4 stages of that testing in such a short time. This means that under their model, when you want to push out these types of treatments that are not COVID vaccines without the proper testing, after a year or 9 months or whatever, they have not been through adequate testing. They are definitely not safe. We have absolutely no idea what they're going to do to people, and it's very unethical to be risking people's lives to test this on them. This is something that the affirming team has continued to ignore. I'll take a point.
How do you get these exclusive health benefits when you still stand for human trials under your side of the house?
I think the difference under our side is we're not willing to put people through trials without some evidence first that it's safe. Under their side, they're just willing to throw people into it, not very far down the line at all. On our side of the house, we support actively going through the science, taking a bit more time to look at the impact of this before we give it to people. Obviously, you do have to carry out human testing to make sure the drug works on humans. But we think there's a big difference between doing it 2 months in when you have no idea what it's actually going to do versus maybe a couple years down the track where there might be a really small risk of side effects, but it's really unlikely that people are going to die. Under our side of the house, it's really risky when you're chucking people into these trials with a very little idea, a huge risk bracket for what's going to happen. That's something we are not going to stand for. Now, secondly on this, what we tell you is that in a non-COVID circumstance, when people don't get these treatments, right, you're pushing out all of these things in a really short amount of time. This is really, really harmful, as I'm going to say, because people start to lose trust in the healthcare system. When you start to do this, you increase the risks exponentially. You increase the risk of side effects, and as we've already told you, at a worst case on their side, people start to die. People start to have awful health implications that impact them for the rest of their lives. The worst case scenario on our side is we've taken a bit longer. People are ultimately a lot safer. The only downside is we've taken longer to make sure we get to that. That's something we are willing to take on the negating side of the house. Now let's move on secondly to the second point of question about how this actually affects people, the way they are as minorities or underprivileged people, and how people trust the system. Now what ACT has told us today is that people will trust things if the government funds it. We've already disproven this to you, right? Because we tell you that not every medication gets all this funding thrown at the government like COVID has. That point ultimately there about people keeping trust falls out of debate. Secondly, they told us that you get faster research and development under their side of the house. Well, on an initial point, I don't really see how this makes sense when you're trying to rush it all in 9 months. I will go on to address this later. Thirdly, we tell you that they ignored all of our content at 1 and 2 about losing trust in the healthcare system. They completely disregarded it and didn't say anything about it. Here's 3 responses on that today. Firstly, we tell you that in a world where people are already losing a lot of trust in the healthcare system, right? Where the anti-vax movement's really big, where lots of people don't like conventional healthcare, we tell you that it's really dangerous to be constantly pushing out unfinished things where people can see the negative side effects and putting them into a world where you have a lot of people who like already don't trust the system, right? What kind of message is this sending to people when they see others in their community going and taking these things that have been like approved by our side of the house and then coming back with these horrific side effects? You're going to be losing even more trust in the system. Less people are going to trust conventional medicine, and this is really harmful. If you take it in the context of COVID, which actors really love today, when you like see this kind of stuff, right? People don't want to get vaccinated when the vaccine is safe. They definitely don't want it when it's unsafe. But even when we get to that point where it is, they don't want to get vaccinated. This is really detrimental to everyone overall because we don't get that herd immunity that they want to get on their side of the house. Now, secondly on this, they try to tell us that you get faster research and development. Firstly, we tell you we don't really see how this happens when they're trying to like push stuff out in a year to 9 months. You can't get like effective research and development in that time. That's why we like the merits of like a longer medical trial for this, right? You can actively carry things out, see how they go. They try to talk about like the long-term effects and about how no one really gets them. But we tell you on our side of the house, we actually probably do get far better long-term effects because we're actually taking that longer period of time to see what the effects are. On their side of the house, they don't get that at all. We think it's better for us to have like some knowledge of the long-term effects rather than none at all. Like even if we can't know everything, we think it's better to capitalize on what we like can know rather than go out there, throw it at innocent people, knowing hardly anything. This makes medicine far better and safer on our side of the house because we can actively carry out these checks and ensure that people are getting quality. Now, thirdly, we had a really big contention today about like people in third world countries and like how they're impacted by privatized countries. 2 points on this, right? Firstly, we tell you private companies care about money. They don't really care about what's happening to people, right? So on their side of the house, when you're just pushing out like solutions really quickly without any testing, the company doesn't really care if people are getting hurt, right? Because they just want the money. They want like that first mover advantage where people are going to buy their things simply because it's out there first. That's really dangerous. What we tell you, we think it's probably a lot better that we like go back and actually wait for these things and have some better like research and development of them. And if that means like waiting longer, investing more money into it, that's a risk like we're willing to take because we think it's far safer and far more ethical, and that's what we stand for under our side of the house. Now next, if we talk about like the women in Kenya who are fed birth control, basically what they told us is like it happens under both sides. We don't think that's necessarily true. We think when you take more time, when people are invested in a long-term research project, right, you're more likely to be held accountable because there's been a process in which like lots of stakeholders have actually been able to come into this, see what's happening, right? That means to benefit management. Under their side, we're like no one's had time to really see what happens. They're just throwing out things. It's way harder to keep track of like who's being given what, right? And these like really vulnerable communities are way more likely to be exploited when there's no control. What we tell you under our side, when we like take a bit longer, it's a lot harder for people to like go and do these untested things out to people. A, because we don't stand for like untested things going out, and secondly, because we think it's probably way better monitored when we have these systems in place. This is why at the end of the debate we tell you we win, because we stand for ethics, we stand for good solutions, we do not stand for people being put at adverse risks that ACT is trying to stand for. Proud to oppose.
Wonderful. I thank the speaker for her speech, and as is traditional, we reverse the speaking order, and so I invite the leader of the negating team to conclude his team's case.
Let me reiterate the information and the moot of this debate. The information has stated that medical trials usually take around 12 years to do. They include rigorous processes in 4 key stages. The moot today is about whether we should allow in the future, as logically assumed from it, that we should get people outside of the trials to conduct the medicines, and so have the medicines. We tell you today that the affirming team has failed to realise and has made a case in such a way that it fails to meet the requirements of this moot. They rest their whole case on the COVID vaccine, but failed to realise the COVID vaccine had gone through all of the 4 stages that would have been done in 12 years. We reiterate to you, panel, that this moot is about allowing medicines to be taken during the trial period. So therefore, we tell you that the coronavirus vaccine case is minimal at best. Look, they failed to understand the implications to and wider society of other medicines outside of extremely rare situations where we have pandemics. They failed to even engage with material about stuff that has to do with more niche diseases that have have smaller populations where higher death rates could occur if medicines were dangerous. Look, here's what each side of the world looks like in this debate. On our side of the world, we see medications being taken to completion. We see all 4 stages going ahead in the time period prescribed or being rushed if they can be done more quickly through funding, which is what happened during the case of COVID. We see better quality medications and we see higher incentives. On their side of the house, we see lower trust models, we see lower quality medications, not only in the short term but in the long term, and overall we see a healthcare system and medical systems that are degrading. So here's why we won this debate. First of all, we have shown to you now that we get lower quality medications really simply. We get medications that are done in the early trials. If we have seen blood clots and deaths from final trials that have gone through all 4 in the Johnson & Johnson vaccines and the AstraZenecas, God knows what could be happening in the earlier stages of these trials. We have not simply done this before on such a large scale, and there are too many known and unknown risks. Secondly, we have shown that actually low socioeconomic people and vulnerable groups will not benefit. They say they need the medicines of us, but they have failed to realise the niche of these groups of people who have systemic distrust of power systems and medical companies who have done harm to them in the past. They've also really failed to properly engage with our material about how these pharmaceutical companies manipulate the third world, because they can get lots and lots and lots of really vulnerable and desperate people to try out their medicine to try and get the idea that it is safe. It is not nice to be doing this to these people. So we've actually shown that under our side of the house, you have better respect for people and better quality of medications. Look, we've also explained really clearly that we would see a complete loss and decrease in the quality of medications. It's really clear that if companies, we have told you that if companies invest in medications and waste all this money for some big failure that has big public relations consequences, we see a situation where companies will be less incentivized to try out new things and continue doing the old way, if we remember the graph that I showed you earlier. Now, in this debate, they have said that they get those benefits because apparently, if the scientists can do it in the short term, they benefit the most people. But we must remember, and we've said really clearly, that scientists are rational people who follow the process and understand that their actions have implications. They know not to rush it, and they raise legitimate concerns when doing this. Look, let's look at this holistically at the end of the debate. Which we are trying to prove to you, we have done a great job of proving to you today that we get better health outcomes for all people, including vulnerable communities, and better medications. We've done that by saying we get higher trust from those groups who already have distrust and people who are hesitant about medications. We tell you that we get to go through all 4 stages without risking people's lives. Unfortunately, they've tried to use a single and isolated case and failed to make it work, and that's why we've won the debate and we've failed to close.
Awesome. Thank you. I thank the speaker for his speech, and I invite the leader of the affirmative team to deliver the final speech of the debate today.
Both sides of the House agreed that people who are most affected by the virus or health risks were the most important people in today's debate. On our side of the House, we did tell you that an entire region had to get sick in the years that it took a vaccine to get fully approved, versus one household who was the 2 to 3% difference for a vaccine that was produced in a month to a year. That's the reality that CNI failed to engage with today. 3 main points of question to today's debate. Who gets better health outcomes for wider society? Who benefits impoverished communities? And thirdly, the research and development of vaccines. So let's look at this first point of clash, who gets better health outcomes. So note that the main thrust of their case came with a human rights violation and human trials. But note, they also had to stand for human trial testing on their side of the House and comprehensive testing in this policy that they were already committed to. Within the morality of human testing, it's another debate in its entirety. But even at the best, at the point we tell you we have greater pressure by the government and the entire international community to produce results, we tell you that's far more likely for these companies to be held culpable to rights violations. We were going to tell you that we were only going to give these human trials if it was provided effective at a lab test. They sort of mischaracterized that we're just going to be injecting people with Kenya with things that we didn't know what they were injecting them with. Just completely fell on that side of the House. Even in the worst case scenario, we still tell you that companies that are likely to do this, that like Machiavellian at best, are still going to occur on this on both sides of the house. Let's look at the other main thrust of the case. This came from more disadvantaged areas, and the only real analysis we heard from this was cost. Like, first of all, we just tell you that vaccines typically don't have massive amounts of cost because government subsidize them so heavily, because getting people vaccinated is what saves the country. But secondly, we tell you, even though it's like $10 for a vaccine versus losing years and years of income when you contract the illness, that's a trade-off that millions of people are willing to make. Because we tell you it's about the lives, about the marginal benefit of a few people versus the majority that you have to accept when you wait years and years for a vaccine to develop. We're telling that we can't wait for people to take a bit longer. They massively mischaracterize time. We tell you time is the most important thing to debate, and a precedent simply does not allow for this. But then let's look at their main pushback. They told us that COVID was an exception. First of all, we tell you that our model encompasses like moderate to extreme things. This looks like SARS, this looks like Ebola, etc. We tell you that these had massive response, sort of similar to COVID, and that because of these outbreaks and how quickly they were dealt with, that's when you lowered the health risks because of how high stakes these vaccines were. We tell you that that's really important, that basically their entire engagement fell when they hinged their case on one example we gave you. But let's look at our second point of clash on who benefits these communities. We already sort of engaged with this, but on this point of trust, that was the second analysis. We tell that people just lose trust in the government when you tell them that you have to wait 12 years to provide your family with income or a job. We tell that people like anti-vaxxers are probably never going to change their mind, but at the point where you have the opportunity to save thousands of lives, we tell you that doesn't lose your faith in the government. That's where you get support. But thirdly, and lastly, on research and development, we tell you that scientists are actually legitimate to providing tangible health benefits. That was literally conceded in the last speech we heard. But even if companies were as bad as they wanted to tell us, we'd probably tell you that if they get the blame by the entire international community or news for killing thousands of people because of their poor vaccines, because of such high stakes and how visible it is, and how much of a high standard they're held to, we probably get more concentrated efforts. That's when we get the government subsidizing. That's when they get the government writing more qualified scientists, how pressurized the situation is. That's what was really important. But also we see health effects. That was another point that they came up with. We're not going to make a difference seeing the long-term benefits for health with 1 year versus 10 years. We just tell you the 1 in a million chance of getting a blood clot is probably far better than the millions of people dying by not taking a vaccine. So proud to propose.